just make sure got my sound on. There we go. Yeah, so thank you for everyone that's come along tonight, and thank you for coming in every week. Those of you that have been here all the time, usual names coming through on the list. Yeah, oh good, all back. Yeah, sorry about that. Let's just see. Yep, good, cool. So yeah, we're going to get going with week 9 OSCE, and usually around about sort of 20-25 minutes, 25 minutes maximum really. Wanted to do just a little snippet of little snippet for you to get you thinking a few times a week, and it's kept me in a bit of a routine whilst everything has been kind of changed all over the place. So over the last couple of weeks, we've been advertising the rock tape courses. So we did an online course that finished last week, and we have scheduled a rock pods course as well for the beginning of June. That one is now full. So if you are interested in doing one, then let us know, and we can sort something out. If there's enough people, we can put on some more dates. So it seems to have been really popular, people trying to get these qualifications in before everything opens back up again. So yeah, just let me know. And this is the penultimate week of this as well, so we're going to do week 10, and then that'll be it for the OSCEs. I'll kind of run out of OSCEs. No worries, Peter, we'll have to do a face-to-face one, mate, when you're back. Yeah, if you need kind of CPD stuff to go over, then like I said, over the last couple of weeks, we've got a playlist now on YouTube. So all of the videos that we've done for this are now on that playlist. So you can just have a look at that, and then revisit it as many times as you like. It's I think because there's been 9-week gap between the very first one that we did and then this one, like I said, I think it was last week, you've probably forgotten what had happened on the first one. I think I have over the weeks we've been doing it, so you can revisit them and do them again. But you're getting really good, getting the hang of doing these now, which is really good. I wanted to put a little bit more of a challenge in today, that for those of you that have been doing it quite regularly, because of course we get information on these, and you can't ask any further questions because obviously the person isn't there to ask what you want to ask. So that's something that I'd like you to have a think about after this one today. So we're going to get the history as usual, and then think, well, what other things would I like to question in a bit more detail, and what questions would you ask? So have a bit of a think about that, just something new this week. Let's just see who's in. Yeah, usual names. Cool. So what I'll do, I'll just skim over the intros. I think you all know me by now. Plan, as always, is to kind of go through the case history in the fashion that you would do if you were in clinic. Okay, so going to take we've got subjective history, which we're going to go through today, and then working out an objective plan, what we'd like to test, what we're going to do with this person, and then a short kind of medium long-term plan if that's applicable. So we'll do the same with this case as well. And I think most of you have seen this anyway, but there we go. That's I helped to write chapter 2 of the Routledge book, The Handbook of Sports Therapy. So if you're if you want a book, actually, if you think about doing a sports therapy degree, that's what we wrote it for. It was my colleagues at University College Birmingham, when I worked there, we all kind of got together with Keith, who's the editor, and wrote a book that would be suitable for every stage of the degree course. And when it was first released, I think it was something like £120, but I think it's down to, I think it's about 30 or 40 quid now, but it's got everything in there, and it's clearly kind of laid out, that follows the progress of the degree program. The other couple of books that I recommend, especially for this kind of thing, so for OSCEs, is the Differential Diagnosis for Physical Therapists and the book Explain Pain. So it's got all this kind of psychosocial elements to pain in that book, which is really good. Cool. Okay, so we're going to sift through the first appointment then with our sieve. And as always, no recipes, no right answers. You just your thoughts, and obviously this time now the kind of further questions that you would like to ask as well. And you need to justify everything that you've wanted to ask, or the thoughts that you've had, and that's all you can do. Okay, so that's exactly what this session is for. So introduction to the case today, and then Wednesday, objective assessment planning, and then what do we do on Friday? So we've got I think we've had a shoulder pain scenario before. We've got a different one today. So we're going to go through this scenario, and as always, there's no right or wrong. This person doesn't have any specific condition. There are lots of little snippets of information to make you think, oh, it could be this or it could be that. And the whole idea is just to get you thinking. Okay, and then if you do think about something that is really serious, then we need to make sure that we send that person off to the appropriate area, depending on what's wrong with them. Okay, so that's the whole point, is to make sure that our patients are safe with the case history that we take. So I think most of you have seen this before. So everybody's got different elements of different things that contribute towards their pain. Some people, like on the left-hand side there, the more biomedical, biological, biomechanical kind of presentation, if you like, and that is the majority of their symptoms. And if we kind of tweak the biomechanics, then it may ease their symptoms pretty quickly. But if that's the only thing you've got in your locker, then you're going to miss the people that have got maybe psychological aspects, or their home life and their work life is contributing towards their symptoms as well. So it's not just as easy as there's a tissue that is causing the problem. Okay, sometimes there are other things as well in the background that can contribute to people's pain. So it's certainly far removed from the way that I was initially taught. We got asked for the tissue causing the symptoms, and we know now that tissues don't necessarily cause symptoms. So even if they're injured, they may not present as painful. So there may be other things that are contributing to it. So that's something that you need to consider as well. So that's why we've got the psychosocial aspects listed in our sieve. Okay, so we want to have a look at what things are going on in their life that could be contributing to their symptoms or their recovery. If you were going to give someone exercises or give them advice about their lifestyle, then what kind of things may be barriers to them being able to do those sort of things, and that's what should go in that psychosocial box. And then the bio part is obviously the big part of what we look at in terms of therapy training. This is the kind of thing that we focus on a lot. Maybe those boxes should be equal, to be honest, with the psychological, social side as well as the bio side as well. But yeah, we can then split the bio into different regions or different tissue, if you like, to see if there is anything that's obvious that's potentially causing these symptoms that the person's feeling. So we've got we know that in an acute injury that quite often you will have painful symptoms in the acute stages, but as things develop over time, hey John, no worries, as things develop over time, it's less likely to be the tissue causing the issues, and it's more likely to be other factors. It could be something serious as well, and that's something that we have to kind of weed out with our questioning. And going to have a chat as well with Dan Lawrence this evening at 8 o'clock if you're coming back, and we're going to be talking about Cauda-Equina syndrome. So if you've not heard of it, not really sure what it is, or if you have and you kind of got a way that you question things, then we're going to go into a bit of detail about how to test in the clinic, and how useful those tests are. So it kind of not directly related to this case, but it kind of leads on with the clinical reasoning pathway that we're covering tonight. So this is our patient. So we've got Jay, a single 17-year-old college student, recently found out that she's pregnant. Okay, so you can start filling in your psychosocial bit of your sieve straight away. She's no worries, Louisa, no good. She's presents with her controlling mother, who is very disappointed with her situation due to her pregnancy. Jay has been advised to give up riding her horse. Okay, random bit of information in there. Okay, so like I said before, have a think, well, what kind of questions would I want to ask a little bit further on? Don't necessarily have to put them in the chat room now. You can put them on the Facebook page later, but what other kind of detail would you like to know? So she's 5'6" and she weighs 12 stone. She looks tired and seems to be in discomfort and holding her arms across her body. Okay, so her presenting complaint, she's complaining of a constant ache and stiffness in her right shoulder, so trapezius and deltoid, which seems to be traveling up into the posterior lateral part of her neck, so this kind of region up here. Her entire arm is aching and feels heavy. She complains of intermittent pins and needles in her entire hand. Okay, so we've had this a few times on these OSCEs, so we should know those kind of things pretty much, boom, straight away. And this is the thing with doing these. When you get someone come in with these symptoms, immediately you should think, right, it could be that, and then immediately you start to test it, and you have it on your list. And the more and more you do it, the quicker you get at recognizing these patterns. Okay, so it's no coincidence that if you've been doing this with me for the last 9 weeks, then this kind of thing, you should be thinking something automatically straight away. Okay, so she described a bruised, sore feeling across the entire trapezius distribution. There is a sharper pain in her right upper thoracic area on standing up straight, and especially after sitting. Okay, so that's a specific bit to top of the upper back. So the onset symptoms came on quite suddenly 2 weeks ago. She believes that she was doing a lot of mucking out at the stables over the weekend when the symptoms started, and she is right-handed. Okay, her daily pattern, the symptoms get worse as the day goes on, and she reports feeling very tired since the problems started. Okay, so maybe there's a bit of a link there with the symptoms and she's getting and tiredness. Okay, so a bit of a clue. Aggravating factors, initially activity was the aggravating factor, and in general is becoming more difficult. So activity is becoming more difficult and causing more pain. Okay, she tells you that her symptoms felt really bad after she carried a heavy rucksack bag 1 week ago, and she carried this over her right shoulder. All right, so that's when it was really bad. Relieving factors. So whilst resting, the symptoms feel easier. However, the pins and needles symptoms can be present during rest. Okay, so that's a real big clue. Those of you that have done these for a number of weeks. Okay, so usually if it's a musculoskeletal problem, it does feel a bit better when you rest it. But the symptoms are persisting during rest. Okay, so that may indicate something else. So the symptoms are gradually worsening. Again, that's not a very good sign either. If something's getting worse, usually musculoskeletal problems will resolve in a few weeks, even if you just leave them alone and just rest them. Okay, so the fact that they're getting worse may be indicative of something else. She's seen the midwife recently, who suggested she visit an osteopath. Of course she did. Okay, could be any therapist, any good therapist. So accidents or trauma. She had a fall from her horse 6 months ago whilst jumping. I'm guessing horse jumping rather than or jumping whilst on her horse. She fell on her head. Her chin struck the ground and her cervical spine was pushed into extension. Okay, luckily she was wearing an approved hat. Okay, not very good protection for your chin. She was very sore for a week, but did not seek any treatment. Okay, so think about the mechanism of the injury and what could have happened there. Okay, no wonder she's been told not to ride her horse again. So she's been taking Nurofen, 200 milligrams on and off since she was approximately 14 years old. Okay, so on and off for pretty much 3 years. Since her early teens, she suffered with pains in her thoracic spine and periscapular muscles. So that's the muscles around the scapula, if you're not sure what that means. She's been told this is due to an idiopathic scoliosis. Okay, so that's something for you to have a look at. Actually, if you've never heard of that term before, then have a look at what idiopathic scoliosis means. The consultant told her it was not severe enough to consider surgery. So Jay's mother tells you that Jay was a breech birth, okay, but that hasn't any impact on the musculoskeletal issues. So Jay has suffered from a really bad chest infection 4 months ago. She has only just recovered and still feels a little breathless, and she believes that this has got worse recently. So again, something else that's got a little bit worse. Something to, if you could question her, what kind of questions would you want to ask? I don't necessarily have the answers, but you can always ask the question. Okay, so intermittent pins and needles, mostly in the whole of the right hand. Okay, so that's a big clue again for those of you that have done this before. But for 1 week, she has experienced the same. Yeah, good. Yeah, a bit. Yeah, we predicted COVID with this one. Okay, but for 1 week, she has experienced the same symptoms in the left hand. Okay, right. So she's had this problem in the whole right hand, but for 1 week, she experienced the same symptoms in her left hand as well. Okay, so what could that potentially be? There is also a long history of severe headaches, which have become worse in the last few weeks. Occipital frontal in location. Okay, so kind of around this area into this region here. Okay, where am I? Yeah, Jay's mother reports they started when Jay was approximately 7 years old. So she's been having these headaches for a long time. But Jay's mother and father got divorced about this time. Okay, so then that fits into that psychosocial box nicely. Antenatal. So Jay is 28 weeks pregnant. This was confirmed by an ultrasound examination 4 weeks ago, which also showed the baby was developing well. She had done a pregnancy test, which came back negative, but thought she might be pregnant as her body was really changing shape. Okay. And then endocrine system. Jay reports that she feels cold and her voice is hoarse. Okay, so bit of a clue as to a condition there. So we've got lots of clues dropped into that one. Okay, so this is your task for this week, the usual kind of things. Okay, so have a list of what you think, make a list of the things you think it could be. I was teaching last Tuesday, so apologies for not uploading the video till later, but this should be uploaded for tomorrow morning, so you can watch it back again. So create a bit of a list of the symptoms, what you think it could be, and then have a think about the testing as well that you could do, but also have a think about the further questioning and what other things you might ask. Okay, so as always, pop things on the Facebook group if you want to. So it's if you put @MTE CPD in the Facebook search bar, it will come up with our group. But if you don't want to do that, then just message me, and you can put your thoughts down on there if you want to. Quite happy to have a chat with you over the messenger about things that you're thinking about. Yeah, give it a go and post in if you've not done it before, because it's a friendly group. We're not gonna and there's no right answer either. There's you can't be accused of being wrong. So but what you've got to do is justify it. Okay, so you've got to show that you've done some research behind why you think it's the symptoms that you think it is, or the condition you think it is. Okay, cool. Right then, bang on 20 minutes. It's as if I've done this before. I will see you next Wednesday at 6 o'clock. Good luck, guys.